Okay, good afternoon, everyone. I'm Jen Clancy, Humanitarian Policy and Advocacy Advisor at the Australian Council for International Development. I'm very pleased to welcome you today to the third webinar in our webinar series with the Centre for Humanitarian Leadership and the Humanitarian Advisory Group, No Safe Space, Crisis Response in COVID-19. I would first like to acknowledge the traditional owners of the lands upon which we meet. In Canberra, for me, that's the Ngunnawal people, and pay my respects to their elders, past, present and emerging, and any Indigenous people that we have joining this webinar today. We have a brilliant panel of speakers with us this afternoon. Here they are, who are going to reflect on the question posed in the title of this webinar: what happens when disaster strikes during a pandemic? Unfortunately, we didn't have to wait too long to start to answer this question, as the Indo-Pacific region in particular has been dealing with a number of natural hazards and disasters since the start of the COVID-19 pandemic. Our first panellist is Dr. Manu Gupta, co-founder of Seeds India, a not-for-profit organisation that works to enable community resilience to disasters. Manu sits on the board of 9 global and regional organisations, including the Asian Disaster Reduction and Response Network. And he's also part of the Leadership Council of the NEAR Network, which champions local leadership and ownership in humanitarian and development systems. Our next panellist, Arnel Capilli, is the Deputy Executive Director of the Asean Coordinating Centre for Humanitarian Assistance in Disaster Management, the AHA Centre for short. Arnel has 20 years of experience in emergency response planning and operations and humanitarian coordination. Over the last 7 years with the AHA Centre, Arnel has led a number of large-scale ASEAN responses, including to the 2018 earthquake and tsunami in central Sulawesi in Indonesia. Our next panellist is Elisa Pethy Rocco Tonindao, the Director General of the Fiji Red Cross Society. Before commencing with the Fiji Red Cross, Elisa Pethy worked for the Australian Government's Fiji Community Development Program and had a distinguished career within the Fiji government, including heading the Department for Women, the Department for Poverty Monitoring, and the Department for Social Welfare. Our final panellist, and last but not least, is Craig Kentwell, who's the Director of Humanitarian Operations at the Australian Department of Foreign Affairs and Trade, DFAT. In this role, Craig manages DFAT's humanitarian responses, including response logistics, civil military cooperation, and humanitarian training for DFAT staff in Canberra and those posted overseas. He's led a number of responses for the Australian Government, including to Cyclone Pam in Vanuatu, Cyclone Winston in Fiji, and the evacuation of Umbay Island in Vanuatu. Craig has worked for DFAT and before that AusAid for 10 years, and prior to this held a number of positions in federal and local government and in the private sector. Over the next hour and a half, we're going to speak with these panellists about how they have responded to and are preparing to respond to crises during the COVID-19 pandemic and the challenges and maybe even the opportunities that this presents. There'll be an opportunity for panellists to answer your questions, so please type them into the Q&A tab at the bottom of your screen, and you'll find that by hovering your mouse over the bottom of your screen. Questions can be liked, a bit like Facebook, which upvotes them. So please go on and also like your favourite question, because the top questions will be the ones that we ask to the panellists. Okay, without further ado, I'll start bringing the panellists into the discussion. First of all, we're going to go to Elisa Pethy in Fiji. Elisa Pethy, just 1 month after the World Health Organization declared COVID-19 a pandemic, Tropical Cyclone Harold struck the Solomon Islands, Vanuatu, Fiji and Tonga. Elisa Pethy, what were the specific challenges that the Fiji Red Cross Society faced in responding to TC Harold due to COVID-19? And how is this response different to other responses?
Thank you, Jennifer. Well, this response was different in that when TC Harold, like any cyclone that hits the Pacific Islands or Fiji, people are normally directed to evacuation centers. And the evacuation centers are usually community or village halls, or even bigger houses that are built by individuals in a village. So this became a concern for us, because when COVID-19 came in, what we have understood up to this point is that staying together in these confined spaces enabled the spread of the virus. This is the kind of information we're getting. So what do we do now that people are forced to go to evacuation centers? There was a need to provide shelter. So one has to acknowledge the challenges that government had to deal with, to restrict all these restrictions on social gatherings had to be thrown out the window, because you have to have hundreds of people congregating in communal areas, just so that they can be sheltered from the elements. So for us, this began, a new form of horror. How to deal with social distancing in an evacuation center? How can you not have visitors when everybody are all visitors in the evacuation centers? How do you avoid close contact? How do you stay home if you have a cough? Because everybody has to live in evacuation centers. So how do you wash your hands often if there is no water running? And so these things became such a challenge to us, Red Cross, and how we were going to deal with this on a day-to-day basis, especially with people moving in evacuation centers. And the other problem that we were faced with was TC Harold struck the islands, the maritime zones. And at this point, the government was trying to restrict movement to the maritime zones, so that, because it would have been harder if COVID-19 had spread across to the islands. So in our response to the government held back on responding immediately, because we were all trying to work out how best to deliver the humanitarian service, and also to respond to TC Harold, out in the islands, and how we were going to do it without transferring COVID-19 or the possibility of it moving across to the islands. So this became a huge challenge to Red Cross, and it became a challenge in trying to move people across borders. The other huge challenge was first time ever going into online training, because community-based volunteers are just people who have a lot of passion for the work. And a lot of them have never ever done this distance, so-called learning, and the answering of questions. So we had to set up a whole system of support for our community-based volunteers, because of the constant questions that were coming from the ground, because people were unsure themselves, because there were mixed messages that were coming through, and people did not quite understand the kind of messaging that was coming through. And so we had to train our volunteers, plus move our volunteers to go to the islands to respond to TC Harold, but making sure that we have their interests first, that they are protected, and that they must understand that the guidelines to COVID-19 has to be in place all the time. So when they got to the islands, it was hard for us to do our kind of assessment to work out who were the real vulnerable people. And the community leaders were left to distribute the items that Red Cross had brought, and we found out later that they did it according to their assessment, whereby to a community leader, it is best that everybody gets a little bit of everything, rather than basing it on some kind of assessment that Red Cross. So our initial damage assessment, or our initial assessment, became deferred for about 5 to 6 weeks, when we could take our staff across to the islands to do our proper first assessment.
Thank you, Elisa Pethy. That's really interesting, and a lot of challenges that you all had to contend with in that response. I'll move to Craig because, Craig, the Australian government also responded to TC Harold across all 4 countries that were impacted. Can you talk to us about what DFAT found were the challenges and even opportunities in responding to the cyclone during COVID-19?
Yeah, thanks, Jen. I think it's important too to sort of think about the context of when this was happening, and we were right at the start of the COVID response, and DFAT has responsibility for consular issues as well as the humanitarian. So our department was really stretched with assisting Australians to return back to Australia. So to date, we've supported 25,000 people returning to Australia, over 330 flights that have been organised. So a lot of our normal crisis response mechanisms, our crisis centre, our deployable crisis response team, the surge support that we have available to us in Canberra, was committed to the COVID response. So we sort of struggled, I suppose, with staffing and access to a lot of the usual mechanisms that we have within our building to sort of respond. We also deal really closely with the Australian Defence Force and some of our deployable teams, like our medical teams and search and rescue teams. Defence had just come off quite a significant commitment in support of the Australian bushfires that ravaged the country in December and January. So a lot of their maintenance cycles and things had been interrupted. So the availability of ADF assets, Australian Defence Force assets, was not guaranteed. It's never guaranteed, but it was a little bit uncertain at those stages. Our medical teams, our deployable medical teams, again, we had domestic demands because of COVID, but also restrictions on international movement of those teams. So when we were shaping our response, and a response to a big cyclone is normally a combination of deployable teams, experts that we deploy to the field, funding through NGOs, Red Cross and partner government systems, and supplies. So that really impacted our response, and we had to sort of exclude the technical teams that we would normally provide, so the Australian medical assistance teams and search and rescue teams. On the logistics side, we had to develop protocols for goods handling, and we had to make sure that these were agreeable with all of the Pacific countries, but also had to be consistent with what France and New Zealand were doing. So as part of the France agreements, France-Australia-New Zealand agreement, we all sort of coordinate very, very closely together on a response. So we had to work quite closely with our French and New Zealand colleagues to develop a set of protocols on how goods would be packed, how they would be handled on the planes, how they would be disembarked at the receiving country, make sure that Defence were happy and able to sort of meet those protocols, and that we had people on the ground who understood the protocols. Within the country, and again, we responded to 4 different countries. Most notably, our responses were focused on Fiji and Vanuatu. We had 8 Australian Defence Force flights travel into the country. And I think it's worth reflecting too that the Harold hit in parts of those countries that are probably more isolated than Pam, Winston and Gita. Cyclone Pam impacted Port Vila, the main airport in Vanuatu, whereas this time it was a bit more remote. Same in Fiji, it was down in Kandavu and the Southern Islands, so more remote. So getting information is always problematic. The COVID handling protocols at the receiving airport certainly slowed down the flow of supplies, and I know in Vanuatu we had to coordinate really closely with the French and New Zealanders to make sure that we didn't have planes arriving on the same day, so that the airport handlers in Nassori Airport in Port Vila had an opportunity to unload one plane, stock up warehouses there, treat supplies, have a bit of a break before they could get ready for the next one. There was also restrictions on the movement of people within those countries, and that applied to civil society as well. So again, shaping our responses, we had to look at the capacity of NGOs and civil society in the country to help with distribution of those supplies. We also had a general election in Vanuatu. These things, there's always a political element to them, and there was a new government being sworn in the first week of our response over there. So quite a few challenges. I mean, the basics were the same. It was, people, money, and supplies that we look at providing, but certainly there was a lot of difficulties that COVID threw in. I think in terms of the opportunities, because we couldn't deploy teams, it really helped us rely on local support and really helped push the sort of localisation agenda, where we had a lot more local engagement than I think would have otherwise been the case. So I think from our point of view, that was a really good thing, a big tick that we probably didn't send as many people as we normally would. So I think that's probably my quick summary, but yeah, happy to take questions from anybody later on. Thanks.
That's great. Thanks very much, Craig. And I think a number of us see that the potential for COVID to really drive the localisation agenda forward more quickly than anything else could be one silver lining of this whole pandemic. I'll move over to Arnel now. Arnel, the Asean region is one of the most disaster-prone regions in the world. Can you tell us about some of the disasters that have impacted the Asean region during the pandemic, and how these responses have been different due to COVID-19?
Thanks, Jennifer. Pleasant good afternoon, good morning, good evening, wherever you are listening right now. Well, first of all, let me thank the organizers, the Center for Humanitarian Leadership, the Australian Council for International Development, and the Humanitarian Advisory Group for organizing this webinar. I think this is very timely. In response to Jen's question, there are a lot of disasters in the ASEAN region. We have been monitoring several disasters. So, fortunately, none of them are big enough that would require international assistance. But certainly, there were a lot of local and national responses. But I think what is good is to understand what's the common thread among all of these countries, at least for the 3 countries in the Southeast Asian region which are most likely to host a large-scale international response, large-scale disaster response. And these are the countries of Indonesia, Myanmar, and the Philippines. And I asked colleagues from informally how their respective NDMOs, their national management offices, would respond. And the common thread is that they would like to maximize local resources. This will be more of a national local response. Indonesia, for example, specifically said they will not request or accept international assistance, be it personnel or relief items. They would prefer cash, and as a last resort, probably loans. Myanmar will follow current protocols as stipulated in the Disaster Management Law of 2015, meaning to say the same law applies COVID or non-COVID. For the Philippines, they also mentioned that they will not request for international assistance, but they may accept on a case-by-case basis based on identified gaps and priorities. I guess some of the lessons that we learned from this statement from the NDMOs would be they would rather that the international community support local action. I mean, local action should not be a buzzword, but it has to be operationalized, it has to be strengthened, and it has to be respected. Yes, most AMS, most member states from the ASEAN, particularly those 3 countries that I mentioned, will not request for international assistance. And this has been what they have been trying to say to us before COVID. I remember specifically during Central Sulawesi response in 2018 in Indonesia. Several international organizations asked me, how do we support Indonesia? And I responded to them, respect their decision that it is going to be a national response, respect their guidance to channel support to local organizations, respect that they are not requesting any assistance, international assistance, but would rather accept assistance based on their priorities. This is pre-COVID, and this is probably going to be the same way that they're going to position themselves during these challenging times. Second lesson that we learned from this is that I think it's the right time to evaluate our preparedness activities and capacity building programs. You know, if we planted the right seeds, we will have a good yield. However, if we still insist that those countries or communities or organizations or local responders still need our assistance from the international community decades after capacity building to support them, perhaps we need to recalibrate our programs because clearly it did not achieve its purpose. And the final point that I'd like to raise here for the first question, a lesson is, I think we need to challenge the way we do things now. Before COVID, it was add value. During COVID, I think it's more than that. It should be looking or searching for the higher value. It has to be more targeted support to the communities, to the affected population. We should dig deeper, ask the why. Why do we have to be there? Why are we providing this assistance? Is it really absolutely necessary that we are on the ground? Is there something we can support with remotely? And the most important change COVID has triggered is the idea, probably, of remote support. Thanks, Jen. Over to you.
Thanks very much, Arnel. It's really interesting and great to hear those messages from the ASEAN region about supporting countries' own local action. And it's great to hear that loud and clear and that's one resounding message from the region. Okay, finally, we'll move on to Manu. Manu, India has also experienced its fair share of natural disasters during the COVID pandemic. You've experienced Cyclone Amphan and also widespread flooding. Manu, can you please reflect on what were the challenges that government and civil society faced in preparing for and responding to these disasters during the pandemic?
Thank you, Jennifer, and good morning, good afternoon, good evening to all. Happy to be here and part of this very enriching discussions as I hear my previous speakers from Pacific and Southeast Asia. So here's some responses to your question, Jennifer. Yes, we did have Cyclone Amphan towards the middle of May, which is when there was also the COVID-19 scare at its peak, and there was a nationwide lockdown. So just to give you the scenario as the cyclone hit, it was a super cyclone, which meant that wind speeds reached up to 260 kilometers an hour. Very rare summer cyclone that has not hit this part of the world in this season. There was the pandemic situation, as I said. There was the need for healthcare, but also there was a nationwide lockdown, which meant there was restrictions on travel, restrictions on supply chain, restrictions on people even moving out. And then there was the population dynamic, which is basically unusually high number of people who had moved back from urban areas due to lack of work into their rural homelands. And obviously they were overburdening the existing infrastructure like schools, hospitals, even housing. And last but not the least, there was also the economic downturn, which meant that the farmers, even though they had a standing crop, could not get fair prices in the markets because the markets were down. And those huge migrant population that had moved from urban areas back into their homes were without work. And so, there was obviously a great need of, support for food. So the challenges that governments and civil society organizations faced were very much what, the previous speakers have spoken, but let me just highlight few of them. One was, of course, the extra population load, and this was particularly for governments to up their response to be able to, cater to larger number of people in that little time window that we had before the cyclone. Save evacuation, so obviously in that hurry, people with symptoms, people without symptoms, and even people who had been tested positive but were asymptomatic were all mixed together in the same evacuation centers. And so obviously there was a spike in cases. Even 74 rescue personnel of the National Disaster Response Force later on tested positive for COVID. There was obviously, like the previous speaker spoke about, hygiene and social distancing challenges in these mass evacuation centers. And I think the critical area that got hit the most, and that was a challenge for the governments, was the continuity of healthcare, which meant testing and movement of patients to critical care and differential needs. For civil society organizations such as ours, yes, like everybody said, it was this time a very, very hyper local action, because of the challenges in movement, in transportation. Even national personnel from New Delhi could not go into these remote hit areas because there was no transport, there were no air or train travel to these areas. So a lot was dependent on community-based volunteers, which also became a challenge because obviously they were not trained to handle a double disaster. So how do you provide quick online basic training to these workers, distance learning as was said earlier? And how do they take care of themselves? Like I said, rescue personnel getting infected and all of that. Targeting was one other problem. Usually the civil society reaches out to the people who are the most vulnerable, but there was a confusion initially as to who are these high-risk people. People identified as high risk due to the pandemic were not exactly overlapping with people who are at high risk to a cyclone, and that created initial communication challenges for our frontline workers in trying to reach out to the people who should be reached out on priority. And so that was a big challenge. Food supplies, a lot of the rural population up until then, because of that extra load and because of very little work, were dependent on external food aid, both from the government and from civil society. And all of that was lost in the cyclone and the torrential rain. So, you had to augment the supplies, yet you had no supply chains to support you on that. And so these were some of these ground challenges, not to miss out on the point that as a civil society organization who have to raise funds from public, from institutions, normally in emergencies, we could just do about 20% of fundraising as we would normally do, because obviously a lot of this funding has gone to COVID response and has been, the donors couldn't come forth with that generous support that we usually see. As I speak to you now, Jen, we are facing flooding in the northeastern part of India, and already there are reports that flood waters have actually spread the discarded protective equipment like masks from the COVID center into the urban areas. And people have no solution at this point of time. And yes, there are 50,000 people who have been displaced, and they are having to accommodate in some temporary shelters, same social distancing kind of challenges. So I think, we not only are facing one cascading impact after another, but we are also looking at how quickly we are able to learn lessons and apply in another geography, in another kind of situation. Jennifer?
Thank you very much, Manu. They're huge challenges. I've also found it interesting that there are some similar lessons and experiences that have come out from TC Harold, Cyclone Amphan, even though the contexts are very different. So thank you for that, Manu. Now, I'll just take this opportunity to remind all of our attendees that you can ask questions for the panelists in the Q&A box. You can ask them directly to one panelist, or you can ask them to all of them. Also a reminder that you can go in and like your favorite question, and they're the questions that will most likely will have time to answer. So I'll go back to you, Manu, with a second question. Can you talk to us a little bit more about how communities have been mobilising in India to respond to these disasters and also to COVID-19?
Yeah. So, of course, the problem started much before these disasters struck in May and now in June, July. The pandemic was at its peak in April, and that was a time when the government also announced a nationwide lockdown. And so the first initial problems that we started facing were in the urban slum areas of cities of New Delhi and Mumbai, particularly, where population densities are extremely high, and there are 6 people or more staying in 10 feet by 10 feet kind of rooms. And usually in normal situations, these 6 to 8 people would be working in shifts. So, the night shift people would sleep during the day, and then, then they'll be replaced by the people who have just returned from their day shifts. And so that's how they used to operate in many of these areas. And when there is a lockdown, complete lockdown, so all of them have to stay not just for one day, but for weeks and months together. And that's where, mobilizing communities to respond and to be able to practice these social distancing measures was a big challenge. Of course, there was a large scale awareness raising by the government, a lot of videos, mass circulation of messages, mobile applications, so on and so forth. But it still did not reach the last mile, and again the role of frontline workers, the health workers, became most critical. One of the biggest surprise though was these migrant labor. I think even the government of India did not realize the problem until it really happened. India, as per the census, has about 139 million people moving from towns to villages, from small towns and villages to big cities in a normal course of time. That's, I guess, more than 2 times the population of Australia. So that's the kind of number of people who were on the streets because obviously they had no jobs, they were wanting to go back home. And because there was no public transport available, they got stranded in bus stations and train stations on the borders between states, facing all sorts of challenges. And feeding them, trying to reach out to them was indeed a very daunting challenge. And there, I believe, a lot of work of having like a whole of society approach that we have often heard of really worked very well. So, messaging cascading through local chat groups, through WhatsApp and other media, reaching out to your stranded people in your own neighborhood quickly, messages going around like that, housewives cooking food, that spontaneous response by communities was, I think, very unheard of and very unique in this particular situation. One other strategy that worked very well, and this is being spoken about by the Chief Minister of Delhi also, is this community-based triage that was practiced. So initially, of course, just to put in context, Delhi has had its large share of COVID positive cases. As I speak to you now, it's already crossed 100,000. And so the load on existing health infrastructure was very high. And after a few hiccups, the government came up with this home isolation approach and mobilized communities to be able to support those people who have tested positive, have initial symptoms, to stay at home and yet maintain all the measures that they need to for avoiding spread of infection. And I think this strategy was cheap. It saved people from the hassle of going to hospitals and queuing up to get a chance to be treated. And it provided the community a chance to take care of each other. And I think that has worked very well in this situation. And I think this is an important lesson for us to learn. I think going forward, and I'll just stop there, Jennifer, is to look at, whenever we are looking at mobilizing communities in these kind of double disasters, I think we'll have to look at what is that basic minimum approach that applies to both. So from targeting to looking at what are the common vulnerabilities in both these kind of disasters, like nutritional security, like health and hygiene. They cut across all kinds of disaster scenarios. And so how do you build a preparedness strategy that can be that basic minimum and allows or enables communities to be responders as well as participants in that approach?
Thanks very much, Manu. That's really interesting, and it's very heartening actually to hear how well the community members have been looking after each other in India. It's great to hear. I'll move on to Elisa Pethy now. Elisa Pethy, we know that gender-based and family violence often increases in the aftermath of a disaster. And we also know that globally, gender-based violence has been increasing during COVID-19. Can you talk to us about the impact that the double disaster of TC Harold and COVID-19 has had on women and children in Fiji, and how the Fiji Red Cross is looking to support vulnerable groups during this time? I'm just trying to unmute you, Elisa Pethy. Let me see if we can get this working.
How's this?
Yes, perfect.
Okay.
Great.
Okay. While having a chat with the Department of Social Welfare and reading newspaper articles, we've seen, because this is the first time ever that children have stayed home for 13 weeks in a row. And for us in the Pacific, children are so used to running free and playing in wide open spaces. And now parents are left home with stresses of being let go from work. There's stresses of unemployment that affects the household, plus children staying in a home for 13 weeks in a row and not being allowed to play, because I think there was a lot of confusion around how do we interpret this social distancing? Does it interpret itself to the playgrounds where children play rugby? And so some places they were taking children to the police station and asking and arresting children for playing together or swimming together in a river, after coming back from the farm, because they want to have a dip in the river. So children have been arrested because of that. And this caused a lot of strain and stress in families. And a lot of families just the whole thing is new and not being able to cope with this form of restrictions that were being placed on families. So a lot of it spilled out and became what we regard as violence in families, and children were being, hit, and they were undergoing a lot of what parents would call snatching kids, but really it's just a lot of violence based processes that were going in homes. And then what became shocking is that about a few weeks ago, it was released in our newspapers that for the first time, Fiji recorded about 42 suicides in a space of 5 months, and this is really, really high for a small country like Fiji, and in a country where a lot of suicide is, not happening to your next door neighbor. And so for us in Red Cross, when we actually also went out to the communities that were ravaged by Cyclone Harold, we found also a lot of families were undergoing the stress of having to cope with nothing. I mean, UN OCHA came up with a figure like 29 million that was lost in crops, 29 million that people lost in crops. And when we got to the islands, this was like 8 days after Harold, when what people had on their backs was what they had on their backs for 8 days, and they did not have nothing. And so this created a lot of stress within families, and with no food and water. So what we've looked at in Red Cross is we looked at partnering now with Lifeline Fiji. So we are able to refer people that we've seen in communities and families that we can refer to Lifeline, so they could provide them with some support and also do counseling with families and individuals. And there's a few other counseling groups in Fiji, but they have their own target groups. And Red Cross has found Lifeline that it suits the kind of work that we're doing, and they do a lot of support with individual families and individuals, especially in the area of suicide. So this has become a new area for us here in Fiji for the Red Cross to work in. And this support to vulnerable people has also moved across now. We're starting to receive requests from people for livelihood, how do we support livelihood, because it's something new for Red Cross. And how do we support livelihood when this is why I'm very interested in what Dr. Manu is saying, when we're talking about our squatter settlements, they do not have land. So how do you deal with livelihoods in this kind of areas, and where people do not have land, more even just a 10-foot by 10-foot space to live in, and where do you put all this? So there's a lot of work we're trying to do now with the Ministry of Agriculture. We're trying to get support from them in how best we can work with groups, especially in the Western Division, because of how COVID-19 has really affected work there, because it's a lot of it is based on tourism. So this is an area where we hope to venture into, but right now the thing is what we're working with the department. We're hoping to catch up with the departments of social welfare in really how do we address families and how do we address children who are undergoing difficult times, during this time of COVID-19. And now the children are going back to school. It is interesting that some children, parents are not really allowing their children to go to school, which is, again, to me, another form of violating the right of a child to attend school, because we're not sure whether COVID is coming again, and as a second strain to COVID-19. And these are all the mixed messages that people in the communities are getting. So a lot of times we're spending a lot of time in trying to correct the messaging that's coming through and what people are hearing and the hearsay that people are, you know, and in the coconut wireless works widely in the Pacific, as you would know, Jennifer. So it just spreads like wildfire. So, and this is what's taking up a lot of our time also in trying to allay those fears and, you know, and just telling people the information that we're getting from WHO and UNICEF and all and the IFRC. Yes, I think I'll stop there.
Thank you, Elisa Pethy, and it's really great to hear about your new partnership with Lifeline. We'll move on to Craig now. And Craig, can you talk to us about how DFAT is thinking about adapting its disaster preparedness and response practice in the region due to COVID-19?
Yeah, thanks, Jen. And I must say thank you to Elisa Pethy for that sort of account of what's happening in Fiji. I mean, it's really hard to listen to that, and you know, the Pacific countries, you know, should be applauded for what they've done to keep COVID out and to eliminate COVID. And I think it's probably, you know, a little bit easy for a lot of people to slip into a kind of, oh well, they don't have COVID, there's no impact in those countries, but you know, the reduction in tourism, you know, cash remittances from people who've been working in other countries who are now finding themselves unemployed, in some cases unable to get home, the impacts on trade, you know, are huge. And, you know, you could argue that the impacts of this are far worse than any sudden onset cyclone. So I think, you know, DFAT's been putting a lot of effort, and the Australian government more broadly, into assisting countries in the Pacific with preparedness for COVID, and making sure that they're better able to cope with the demand. So things like we've been providing testing equipment, so specialist medical equipment, providing a lot of PPE, the personal protective equipment, flying that out to the countries across the Pacific, starting to look at providing some niche capabilities in the medical sector as well, and whether that's through people assisting remotely. So we're certainly looking at options around, well, not deploying, but having technical specialists who are able to support Pacific countries' health systems, but to do it remotely, so doing it from here in Australia. In some cases, we already had specialists in some countries, and we've been able to sort of reprioritise the work that they were doing. So, you know, a big part of our effort at the moment is really just assisting with COVID responses. Just in terms of the sudden onset stuff, I mean, our supplies that we have in the warehouse, we've got a large warehouse that we maintain in Brisbane and a smaller one in Sydney. You know, we're restocking after Tropical Cyclone Harold, but also making sure that we've got enough equipment and trained people who are on hand to meet the protocols if we need to deploy equipment again in the future. We're also putting a lot of effort into the support that we provide to Australian humanitarian partners. So through the Australian Humanitarian Partnership, we've got 6 of the major NGOs that, through a program called Disaster Ready, they're doing a lot of work with local communities to help prepare them. And I think similar to a lot of the work that Elisa Pethy talked about with the Fijian Red Cross. So, you know, supporting that community level resilience and sort of capacity building. And yeah, just again, touching on those deployable teams. And I note there's a couple of questions in the Q&A there. We are looking at, with our Australian medical assistance teams and other ways of providing really targeted assistance. And that doesn't have to be in country. You know, if anybody's travelling overseas, they'd still need to isolate for 2 weeks. It's going to be hard to find people that are, you know, can get released from work for 2 weeks and then deploy in a country and then have to be quarantined for 2 weeks on return. So certainly looking at exploring how we can best provide those sort of incident controllers and those really niche technical specialists that a small Pacific country just wouldn't have on hand, and looking to be able to provide those to work remotely. So I'll just leave it there. Thanks.
Great, thanks very much, Craig. A similar type of question, but Arnel, how is the AHA Centre preparing for a major humanitarian response in the Asean region during COVID-19?
That's an excellent question, Jenny. To tell you frankly, we are still having dynamic conversations within the organization, within AHA Center itself. My boss Adelina and colleagues are listening right now, and they would certainly say that it has been an interesting conversation on how we would respond and provide assistance to some of our member states, ASEAN member states, who may request assistance from the AHA Center. Just to give you a brief overview about who we are, I think it's important for us to understand that the AHA Center is an intergovernment organization established in 2011 to facilitate cooperation, coordination among the ASEAN member states. We are based in Jakarta with project teams in Myanmar, Philippines, and Thailand. The AHA Center, long name, but for us to be able to really understand the core business is AHA stands for ASEAN Helping ASEAN, and we are the H, the helping part, the facilitating part, so that each of the other member states could really rally support to an affected member state if they require any assistance. Now, to respond to your question, Jen, we're asking ourselves, is it really going to be will there be a gap in the response of our some of the Southeast Asian countries, particularly those that have been affected by COVID? Well, we are coming from the point of view that we need to understand that perhaps the response to COVID may have impacted the capacity of the governments, of the organizations and partners on the ground to respond to natural disasters. Perhaps resources are overwhelmed, staff are burned out, funds have been diverted, and we know that for sure. So how can we enable the national disaster management agencies of these 10 countries so that they can perform their primary role? And that's where we are coming from, that framework in developing the courses of action for our response. So AHA Center has been developing response options. And the first point that I'd like to make is that within ASEAN, I think it's important for us to pre-agree with the countries that may host large-scale response operations. And we are consulting them that in the event of a large-scale disaster during COVID, what are the gaps that they may expect, and the modalities for the response options. This is important for us to understand that, so that we can identify how we can support them, whether we actually need to be on the ground or provide remote support to information management or analyzing data. We also are consulting them in terms of if there is a request for relief items, what may they be? So we also want to understand how we are going to deploy ASEAN stockpile. Currently, we have 3 stockpiles located in Malaysia, Thailand, and the Philippines, and the logistics that would be needed to deliver those relief items to agreed points of entry, as well as the procedures that could fast track the release of these items so that they can go to the affected communities immediately where they are needed most. Number 1, pre-agreed. Number 2, this is where we have a lot of debate internally. Is it absolutely necessary for us to deploy teams on the ground? And I think this is a question that would resonate to a lot of international organizations listening in right now. We ask ourselves, and we're still debating on this, and their colleagues are saying, some colleagues from AHA Center saying that there might be reputational risks if we do not respond to them when we are requested. And I agree with them. But I think we still need to pause and reflect on how we can do things differently, but still deliver the support effectively. I think that's the key word. Really go in deep and ask, what is it that they require? Sometimes you're being asked, we need this, we need that, we need you on the ground, but ask the question, what is it that actually you need from us? Perhaps this is something that can be supported remotely. And that's where I say that it's in search of the higher value. And the third point I'd like to make before I hand it over back to you, Jen, is that I think this is an opportunity for us as an organization to also look at our long-term strategy for the next 5-10 years. And this is where we are moving forward, investing more on preparedness to reduce capacity gaps between the NDMOs of the 10 countries, invest more heavily on capacitating the staff of the national disaster management agencies, as well as partners on the ground, because they are the frontliners. They are the primary responsible agencies, and we can probably invest more on giving them the skills and capacity to do rapid assessment, humanitarian logistics, WASH, signal coordination. At the end of the day, I think the point that we're trying to make here is that if they have that capacity, perhaps there is no more need for us. And we are going to be reducing the footprint, not just at the regional level, but at the international level, because all the ASEAN member states' capacities are almost equal, and they have the capacity, the resources, the expertise to respond themselves. And that is, I think, the model and the trend for the next 5 years, starting from this point. Thanks, Jen.
Thanks very much, Arnel. It's really interesting to hear how the AHA Centre is preparing for response, but also thinking about asking those challenging questions about, do we need to be deploying people, and can we be standing up remote assistance? Now, we're going to be moving into our Q&A session. But first, before we go to questions from the attendees, I thought I would see if any of the panellists have questions for each other. And I believe that, Craig, you have a question first. So if you just want to unmute yourself and ask your question to the panellists, that would be great.
Yeah, hi, thanks. Thanks, Jen. Yeah, probably a question for Elisa, Pethy and Manu with their civil society hats on. And I mean, I think all four of us spoke about localization and how I think, Arnel, you said it really triggered that whole sort of idea about localization and whether we could, do we really need boots on the ground in a lot of these responses? So be really interested to hear from Manu and Elisa, Pethy about what donors can be doing to keep this sort of momentum going. There's, I think there's some real wins have come out of this, and the Harold response, it sounds like it from AMFAN as well. So how do we keep that momentum going and keep this localization push happening?
So do I go in first?
Please, yeah.
Okay, all right. Thanks, Craig. And I think that's a very good question to be discussing this. Obviously, the answers are not ready yet. What we have are initial indicators of how localization makes perfect sense in this kind of a all-encompassing kind of disasters, but also then in looking at complex scenarios such as what we saw in the cyclone plus the pandemic. A few things that I found relevant and from a localization point of view is that this time the response moved beyond the traditional actors, traditional humanitarian actors. And because it was so local, it involved a lot of community volunteers, it involved a lot of frontline workers. And so while that was good in some sense, it also threw in challenges of the adequate knowledge and skills that are required to handle sensitive situations like these. And, so how do you look at better preparedness? How do you look at reaching out to the entire community, making sure nobody gets left behind? Looking at, very importantly, our humanitarian standards that we have been championing all this while. And perhaps the most important is, how do you enable greater strength to the local leadership? And this time, local leadership really stood out as one shining example. And I can say that being a community leader myself in my own community of about 5,000 people, where interacting with the authorities and taking decisions almost on a real time for mitigation, for preparedness, as well as responding, all happening almost simultaneously. I was at my own ends to try and figure out how to go about it. And I think to answer your question, Craig, I feel that we need to look at what worked and what was particularly challenging, and how do you address those needs. And so training comes out as something very prominent. Having a flexible approach from donor perspective on to be able to cater to changing needs for various population groups is another very important approach. And third, I think, is creating those platforms or spaces, which I think Elisa also mentioned, that in Fiji, of creating space for local actors to speak, to be part of that decision making. So creating those virtual platforms, if you like, or any other formats where we get these local leaders to participate in decision making. I think these are the top three that I would vouch for. Craig.
Thanks very much, Manu. Elisa, Pethy, would you like to have a go at Craig's question? Oh, you're on mute still.
Okay, how about that? Okay, thanks, Craig, for the question. Okay, what should donors should be doing to keep this momentum going? Well, what we've done, and that is thanks to DFAT, we've been able to negotiate some new ways of delivering. So, and also and the IFRC funding. But what we've managed to try and influence DFAT is to assist us in taking prepositioned stock to the islands, especially when we analyzed the last 4 cyclones that came through Fiji actually just followed one path, and the same islands were ravaged all the 4 times. So we've been able to now negotiate if we could have sheds to put our prepositioned stock on those major islands that are suffering the cyclone, which is the 4 islands that we've identified, so that they do not have to wait out response that's coming from Suva or coming from the main islands. But we have stock that's there, and when we train the community-based volunteers. So we will be working with community-based volunteers in the next couple of months in doing emergency response training, doing first aid training, and we will also be training them on how to look after the stock and how to manage the stock and how to do initial assessment, Red Cross way, and deliver the NFIs, or the non-food items that we have in prepositioned areas that are there. So for us, this is the better way of dealing with or requesting donors to support localization in this way, the way we can get to them. Because I've also seen the difficulty in Fiji, because sometimes there's a lot of, for the leaders in the communities, they're torn between the government divisions, and then there's the provincial boundaries. And both these 2 boundaries at times clash. And then they are not sure which one to utilize for the best for their use. And so to work with them raises, for me, there's a lot of problems in that, because when government comes, they will go this way, and when the provincial assistance comes, so there is no consistent way to deal with this response and the best way to address the issues that they face. So this is why we are looking at it is best to train in communities, train the volunteers in the communities and in the assessments that we do, and then put in our pre-positioned stock so that they can work with it. And we just monitor the stock, and we go around and do those and do the continuous work with the communities.
Great, thank you.
Does that answer your question, Craig?
Yeah, thanks, Manu, and thanks, Elizabeth. It's really good. I think you know, either ends there talking about sort of, you know, flexibility on the part of donors down to you know, that more sort of tactical level stuff of supporting pre-positioning of supplies. So some really useful insights there for us to take back into our planning. So thank you both.
Thank you. And while we're on localisation, I'm just going to ask two questions from the audience now, also both on localisation. So one is directed at Craig, and I know you've already typed a little bit of an answer, but for the benefit of everyone, can you please expand a bit on what you have observed in terms of greater localisation? And I guess that refers to the TC Harold response. And then I might ask Arnel to also answer this next one. To what extent do you anticipate that the advances with localisation will be sustained beyond COVID-19? So I'll go to Craig first and then Arnel to answer the second one.
Okay, thanks. Well, I'm delighted to say that I didn't actually witness any of these firsthand, because I was sitting in my lounge room in Canberra looking after the response rather than flying into Fiji or Vanuatu. But I think, you know, Manu mentioned before about that need to have, you know, creating platforms and space for local leaders. And I think certainly a lot of the feedback that I had from Vanuatu and Fiji was that because there weren't, you know, international governments or UN or, you know, other big agencies sending their staff into the country, there was space within things like cluster meetings and sort of community meetings for much more, you know, local engagement, you know, cluster meetings being held in local languages, which makes it much easier for people to participate and have a voice and be heard. So I think that, you know, that's the sort of thing that I had heard was happening, was, you know, because there were no international or very few internationals there, you know, there was more space for local voices to be heard. I think we also, you know, we ended up engaging a lot of local labour, local specialists to do the sorts of stuff that we would have sent Australians in to do. So I think there's some lessons there for us about, you know, really questioning the need to have as many people as we do in some of the responses that we've had in the past. Thanks.
Thanks, Craig. And now, Arnel, I'll go to you for the next question, which is, how do you anticipate that the advances with localisation will be sustained beyond this pandemic?
Thanks, Zen. Before I answer that question, I was reminded of a story in 2018 when one big donor organization came to the office, and they were asking, why is Indonesia not accepting direct international assistance? And I was surprised because they were a signatory to the Grand Bargain, and I'm fully aware that they know what they signed, but they are still insisting that, you know, they should be able to send their team to the ground and do their assessments, that the Indonesian government receives the relief items that they have prepositioned. And so I was wondering, where is this coming from? Now, in response to your question, I think there are two perspectives. One, for all of us listening here, the international humanitarian community, I think we really need to espouse the principles of the agenda and really champion to strengthen and reflect and really put those ideas in our plans on how we will respond in the future, in the next few years after COVID. And also from the perspective of the governments, I think it's more becoming a trend now and a model that they would want to highlight it's a national response, a nationally led response that will be supported on a case-by-case basis, depending on what their needs are. by the international or regional community. So from those two perspectives, this is how we can ensure that the gains that we have for after COVID can be sustained in the next few years.
Thanks very much, Arnel. Now, there are a couple of questions from attendees about surge and about remote management. So I might ask them both and ask who of you would like to respond. So the first one says, remote assistance to communities and people is becoming obvious during double disasters. What has been done, or has any thinking been done to strengthen this aspect? And then there was a specific question for Craig. Have you analysed the effect of not sending the technical teams into the response? Has it made a case for not sending surge in the future? Craig, I might let you answer first, and then I'll ask if any of our other panellists would like to answer.
Yeah, hi, thanks for that. Yeah, look, no formal analysis that I'm aware of, but certainly we are, we're looking at sort of options which involve probably more niche specialists rather than sending big deployable teams. It's really where are the gaps? Where are the gaps that you wouldn't expect small island states to have special technical expertise in, and whether that sort of stuff can be done remotely. And I think in the answer to that question that I typed, I also mentioned that we have been supporting the development of the Fiji emergency medical assistance team. So Fiji now has a WHO accredited emergency team that has a mandate to assist in the region as well. So again, sort of part of that support for localization. But yeah, it'd be good to sort of to have some more thorough analysis of what the impacts were of not sending a medical team into Tropical Cyclone Harold response. But yeah, no formal analysis that I'm aware of. Thanks.
Thanks very much, Craig. Now, Arnel, would you like to reflect on this question as well about remote management?
Sure, thanks, Jen. I was just, at the AHA Center, we have what we call the Asean ERA, the Emergency Response and Assessment Team. They are our rapidly deployable team. We train them. They go through a standard induction course. They come from the NDMOs themselves. So we were debating one time, and we were thinking about why do we need to activate them, because we want a locally led response, right? And we were some colleagues are suggesting that activate those that are already in the country, those who are trained. I asked the question, why do we have to activate them when they serve the NDMOs themselves? In fact, that's I don't agree with that, because that's poaching. You're getting resources from the NDMO because you want them to wear the logo of whatever organization you're trying to represent. And this is where I'm totally against that, because if we have sufficiently trained them and they're on the ground, they are resources of the government, they are resources of the community. Let them be, let them do their jobs and provide that higher value of technical support, technical specialists that may be done remotely from our EOC Operation Center in Jakarta. I was looking at some of the comments. Data exists, they are there. We just have to look for it and help those NDMOs really process and analyze those data so that they can make that informed decisions remotely. We don't even have to be on the ground.
Thank you, Arnel. Manu, would you like to respond?
Yeah, just a quick response on that, Jennifer. I think, the challenge of remotely managing these communities, really hit us on our faces when, these double disasters happened. The good part is that, communities have their own coping mechanisms, and that includes managing themselves, managing their neighbors, reaching out to those who are more impacted than them, or, so they have in place. And obviously, what we need to look at is from moving from this spontaneity, which is great, to a little more predictability in the way we approach this issue. So if we can bring in a little more organize this, you know, either using technology, you know, there is obviously a wide proliferation of internet, or through, you know, chains of messages that go across, you know, social media, for example. I think if we can make these systems more predictable, more organized in some way, I think we will be able to reach our objectives, not to the perfect manner that we would ideally as humanitarians like to see, but I think the message goes across in double quick time, and it serves the purpose.
Okay. Thank you, Manu. Now I just want to slip in one last question, even though we're running over time, because it's super interesting. Lots of people are keen to hear the answer. So it's from Sandy, and she said she was really interested to hear Elisa Pethy's comments about the assessment challenges in Fiji. She said in other contexts in the Pacific and elsewhere, it's also been the preference of local leaders to have blanket distributions rather than those focused on those who are apparently most vulnerable. She's asked the panelists, could you talk about what you think or have seen have been the outcomes of this kind of blanket rather than targeted approach? The question's a bit longer, but I might just keep it at that to keep it quick. And I might ask Elisa Pethy if you would like to reflect on that first.
Well, for blanket distribution, for us is not the way to go, because even within a community that has been badly ravaged by Cyclone Harold, there were specific needs that were in the communities, and so doing a blanket distribution would not have solved it. Because when we did come in, we found, because the communities were not very aware of inclusion aspects of, you know, of assistance. So in a lot of the communities we went to, we found a lot of people with disability who were just left. You know, they did not have access to water. They did not have access to proper showers and proper toilets. Yeah, so they were living on their own with no system set up in the community. So blanket distribution, maybe it has its place, but for me, if for Red Crosses, if we're going to deliver humanitarian service, then there has to be some form of specific assessment in communities, because not all communities see things the same way, you know, and a lot of things drop off, like women, you know. When you go to evacuation centers, a lot of the issues are for women, and the issues for the elderly, the issues for those living with disability are not really dealt with, you know, because everybody is just brought in for a purpose, and the purpose is to keep them under a shelter, you know. And a lot of people, when we go in, they're just looking at houses. But when you're going to rebuild, what type of houses do you rebuild? If there are children there, if there are people with disability or elderly with no support, you know, because a lot of the islands, we know the amount of movement from rural to urban. So a lot of the people we found when we got to the islands are elderly people living on their own, you know. So blanket distribution would not have solved some of the issues they faced as elderly. Who goes out to the water tanks to go and get their water? You know, who does? So these are the kind of things that social work, the social work that Red Cross does in trying to organize the communities through the volunteers in how do volunteers actually go to home and assist and families in and individuals with this kind of work. But blanket distribution may have its place for particular purpose, I'm not sure. But for Red Cross, this is what we have seen. Especially, we have had 3 cyclones from December to March there's been 3 cyclones. So, you know, before people can get over one, there's another one. So, yeah, so I'll leave it there. I'll let the others answer.
Thank you, Elisa, Pethy. Well, actually, I'm afraid to say we're running out of time, I think, and there was more to that question which we could have unpacked. Perhaps we can have a whole webinar on it one day. But thank you for your response. Now, I'm just going to ask each of the panelists, just in one very quick sentence, after hearing everything that we've spoken about this afternoon, what is the one piece of advice that you would like to leave with our partners on the call today about preparing for a disaster response during the COVID-19 pandemic? And Manu, you're at the top of my screen, so I'll get you to go first.
Okay, can I give 2 pieces of advice?
Okay.
So yeah, no, I think it's hard to summarize. There are so many things, and it's still work in progress, to be honest. But you know, 2 things that I made my notes on. One was that, you know, how do you look at pandemic preparedness and disaster preparedness as not mutually exclusive anymore, and not one-off. You know, I think we are now getting used to these kind of complex scenarios far too often than we would have hoped or expected. So that's one thing. I mean, you know, how do you start building in protocols, principles, design principles, and we're looking at, you know, even sphere standards being revised to be able to cover both aspects. And the second, I think, is, and this is very relevant from a localization perspective, is to how to make our feedback system from communities, from health workers, far more robust and responsive than we traditionally have, you know. And I can speak a lot about this, but this is something that, you know, is emerging as an area that requires much more attention, much more granularity in terms of the technology or the means to be able to enable that processes from right from the person who is tested positive to the person sitting in the national control center. How do you make those surveillance and feedback systems more robust and simultaneous? I think these are 2 pieces of advice that I would leave for the attendance.
Thanks very much, Manu. Craig, I'll go to you next.
Hi, Jen. Yeah, somebody once told me many years ago that a disaster zone was not the place to be handing out business cards. So, you know, my one point is, you know, you've got to invest in relationships. Relationships are absolutely key to these responses. You can have the best systems in the world, but if the people don't get on, don't trust each other, those systems won't work. You can have the worst systems in the world, and if you've got trust, people will find a way around those. So my one piece of advice would be to, whenever we do get a bit of downtime, to use that time to invest in developing, maintaining relationships with the people that you're going to be working with. Thanks.
Thanks, Craig. Great piece of advice. Arnel, over to you.
Thanks, Jen. Well, the change that we want to see in our sector may be a positive outcome of COVID, which is to really genuinely support local national action. We need to see a substantial decline of internationals, boots on the ground, and the rise of a more targeted support from genuine experts, technical specialists, who can share their knowledge and wisdom to local response. Perhaps it's time for international organizations to shift perspectives and step back during this challenging time and look for ways to enable local national organizations through funding or technical support. You know, we should have done this a long time ago, perhaps 20 years BC, 20 years before COVID. Thank you very much.
Thanks very much, Arnel. And now finally, last but not least, Elisa Pethy, what's the one piece of advice you'd like to leave with everyone today?
Well, one thing I'd like to leave is looking at having a lot of consultations at the local level, you know, and making use of, for me, I have seen the usefulness of understanding local knowledge and seeing and, you know, looking at which part of that knowledge do you need to keep so you can keep moving forward. But I've also seen the need of the bigger picture that we don't necessarily see locally, but somebody who might have had experience in the global sector would bring to us, and what would be the approaches that we can use. And for me, it is successfully marrying the two to try and see how, because a lot of these things, even COVID is new, we never know. So nobody in Fiji knows how to address it. So, and how do we deal with this? So this is why for me, I cannot totally separate the global thinking and the local thinking. But for me, what is important is trying to merge the two and trying to see where it best works.
Thanks very much, Elisa Pethy, and that's a really nice comment to finish our webinar on today.
Thank you.
Thank you very much to all of our panellists for the excellent conversation that we had today and for sharing your experiences. I wish that we had another hour so that we could go through all of those questions. Thanks also to all the attendees who've joined us and for your participation, including your excellent questions, and I'm sorry that we didn't get to them all. A feedback survey is going to be sent out to all the attendees tomorrow, so it'd be really great if you could fill it out and help us know how we can continue to improve these webinars. The email with the feedback survey will also include a link to register for the final webinar of this series, which is going to be held on Wednesday, the 19th of August, which is World Humanitarian Day. And the webinar is going to be called Viral Conflict, COVID-19 During War and Instability. And it's going to be hosted by the wonderful Beth Eggleston, Director at the Humanitarian Advisory Group. So it's one not to be missed. The email with the feedback survey will also contain links to the video recordings of our first two webinars. So until next month, I hope everyone stays safe and well, and we'll say goodbye and sign off for now. Thank you. Bye.
Bye.